Hey, welcome back to the Ready State. One of the most common gym ailments is this thing called knee pain. My knee hurts here for some reason, or right where this quadriceps tendon is inserting right into the bone. So keep in mind, this can be for a number of reasons, right? Suddenly, I don't know, you lost your job, we're in a stressful time, sick loved one. It doesn't matter what, didn't sleep went to Mexico, sat on an airplane. One of the things that happens though, if we remove the environment, which are real sensitizations and triggers for soft tissue dysfunction, is, hey man, sometimes we have what we call an adaptation error, or hey, I trained really hard, didn't do anything for my tissues, got stiff. We know that right after training, for example, one of the first things that happens is your body starts rebuilding its collagen structures, then it starts rebuilding the musculature. So if we don't keep an eye on it, as you know, because you've trained heavy or gone for a long run, it's easy to get stiff the next day. So when we came up with Voodoo flossing, and we started putting it out, one of the things that we appreciated was that if we had 2-pack, then we could go above and below the knee. So what we're trying to do when we Voodoo floss is that the shorthand is it's probably working on lots of mechanisms. Number one, changing how the brain is perceiving what's going on with the tissues. Number two, this tight intermittent compression is pushing tissues out, pushing fluid tissues. When you pop it off, we get a rebound effect coming in. We may be restoring sliding surfaces there. We may be changing local microperfusion. Who knows? Probably all those things at once. And when we ultimately explained this to our friend, Jesse Burdick, he was like, yeah, sounds like Voodoo. So if you're Rich Froning, calls it Lazarus floss. And what we want to show you is that they come in a 2-pack so that you can go above and below the knee. Now, we tend to not to compress the knee cap because the kneecap just doesn't need more compression to the femur, especially when someone's hot. When we see sort of this kind of non-specific knee pain, well, I've just, insertional pain, right? We don't know what the mechanism is, but we know that it hurts. And the first order of business is to see if I can desensitize, decongest, and then improve blood flow to that area. It's a pretty simple idea. So the desensitization first part is, let's wrap below the kneecap. And our basic rules are 50% tension, 50% overlap. Pretty simple. If it starts to feel tingly and weird, pop it off. But notice that I'm able to get down into the calf into the shin region, because as I tug on the skin on the other side, you have to appreciate that system is a closed system. And then if I'm really stiff here, it can be one of the tensioners in the system. So I'm working, especially thinking about, hey, that quad ligament inserts right here on the tibial tuberosity. So I'm gonna go below the tibial tuberosity or so, and then come back up, and then just take a bite, tuck it back in, okay? And you shouldn't be dying. You should be able to manage this for a few minutes. We go above the knee, and what we get here is we're able to think about improving range in this suprapatellar pouch, which tends to get bound down. My sweats are gonna get in the way, but it doesn't matter. I'm gonna get some work done here. The dangerousness of choosing a cute outfit for the Instagram. So 1 rep high, 1 rep low. And then the key here is movement. And what we're trying to do is think about how can I get as much motion in these tissues as possible. So some squatting. I want you to be limited by thinking about how do I get these tissues to challenge some of these end ranges? How can I think about moving these joint in the context of the rest of my body and features? So from lunging, sitting wide into some of these positions and playing around with lateral movements, turning into a squat, or just keeping it simple, grabbing something and spending time in the bottom position, press back up, and working on your squat shape here is enough. What you'll see is that there'll come a moment where you're like, wow, I've got some occlusion going on in here. So let's pop that off after a couple minutes, get as much movement as you need. And what we see is that may be enough to change how some aspect of the mechanic of my lower leg is working. It may be enough to change or unload a tissue that was painful. So think about when someone uses a strap for sort of, runner's knee, quad ligament pain, and all we're doing is they put a little strap on there, changes the angle of force and line of force of that ligament, and suddenly they get desensitized. Maybe it's just the compression that feels better. One of the things we know is that we're gonna get a lot of blood flow back in here. Things are gonna start reperfusing, and they're gonna start sliding again. So what we were after in the gym are simple, deployable, really easy, actionable, highly repeatable solutions to very common problems. So before you go down the rabbit hole of what caused it, let's get this person out of pain. Can we restore their position, decongest the tissues, restore sliding surfaces, whatever the mechanism is, even just changing how the brain felt about that because I had temporary pain. All of those things are valid. We don't care on what level they're working. What I care about is, does my knee feel better, yes or no? And once it feels better, I can then go move again. But thinking to myself, I wonder what's happening upstream and downstream. So the failure, I think, to take the next step is often symptomatic of the gym environment. So we get someone out of pain, they go and train again, fantastic. But unless maybe you dealt with some of the really simple biomotor aspects that maybe caused that, high squat volume, just got stiff, tissues got sensitized, poorly hydrated, didn't sleep, et cetera, we may never get to the bottom of the problem. But first order of business, let's get the brain to stop caring about why it works or why this knee hurts in the first place. Then we can go back to improving the system because that system was working it that way pre-sensitization. You gotta have a plan. It's up to us. You got this.